Most sober living management software was built for clinics, so beds, chores, curfews, and rent end up scattered across spreadsheets and tools that don't talk to each other. When the system was designed for outpatient counseling, recovery residence operators are left bolting on workarounds for the work they actually do every day. Sober living software and operations compared. Here is how to run admissions, daily house life, and compliance for a recovery residence inside one platform. We cover housing and resident management, rent collection, incident reporting, compliance support, and the AI and voice tools built for operators on shift. Running a recovery residence means tracking residents, enforcing house rules, coordinating schedules, collecting fees, and staying compliant, all at once. Sobriety house management software is designed to streamline these tasks, so a single manager can oversee the whole operation instead of juggling separate systems. Sober living homes have operational needs that go beyond clinical records. Bed assignments, chores, curfews, peer support, and day-to-day resident progress in a communal home. When the software was built for outpatient clinics, your team has to sift through modules that don't apply to housing, and that drag shows up in slower onboarding and daily friction. New house staff can get overwhelmed wading through clinical or probation features that aren't relevant to running a residence. Without standard housing modules, teams build custom fields and separate spreadsheets just to track bed assignments and chore rosters. Behave Health was built with recovery residences in mind, with housing and resident management modules designed to handle the work a sober living home does every day. The platform explicitly serves recovery residences, sober living homes, halfway houses, and transitional housing, not as an afterthought, but as a core use case. A house manager can oversee the entire operation, from admissions to daily chores to alumni follow-ups, inside one cohesive system. 6 built-in modules cover the operational backbone of a sober living home. Let's walk through each one. These are the workflows that keep a house full, structured, accountable, and ready for oversight. Module 1. Bed Management. Track bed availability and assignments in each house in real time, so you can see exactly what's open and what's filled. Real-time visibility helps optimize occupancy and makes intake and admissions smoother. Module 2. House Rules and Chore Scheduling. Manage house policies digitally and automatically schedule chores or duties among residents. Everyone's responsibilities and curfews can be logged and monitored, reducing confusion and supporting accountability. Module 3. Resident Attendance and Curfew Tracking. Track when residents check in and out or attend required meetings, with alerts for curfew violations or missed check-ins. That visibility is critical for maintaining structure and safety in a sober living environment. Module 4. Rent and Billing Management. Manage program fees or rent collection with integrated billing tools instead of a side ledger. Behave Health offers integrations for payment processing, credit card and ACH via Stripe to streamline rent collection. Module 5. A resident portal and engagement tools. Residents get a portal to view schedules, upcoming house events and meetings, and community message boards. It empowers residents and builds a supportive community online in parallel with the house. Module 6. Incident Reporting and Compliance. Document incidents or rule violations using built-in forms and generate the reports oversight bodies ask for. The software is designed to support state and accreditation standards, including maintaining Part 2 confidentiality while you run the house. Behave Health adds built-in AI and speech-to-text, designed to cut the administrative load on a lean house staff. A HIPAA-aligned AI assistant is built into the platform to answer questions, draft progress notes, and help with administrative tasks. A house manager can walk the residents and speak observations into the mobile app, and those words become written log entries automatically. The voice recognition is described as a HIPAA-aligned behavioral health speech-to-text, so voice data is designed to stay within the platform. Behave Health is an all-in-one platform, CRM, EHR, RCM, and ERP, designed to support a recovery residence from a single house to a multi-facility organization. Manage more than one house or add an outpatient program under the same system with appropriate data segregation and combined reporting. Through its Behave 360 program, Behave Health offers consulting on licensure, accreditation, and audit-ready documentation alongside the software. A switch includes a structured migration path with data migration, staff training, and parallel go-live support to limit disruption. Stop running beds, chores, and rent across scattered spreadsheets. Book a 20-minute demo of the Recovery Residence platform at behavehealth.com. See bed management, house rules, rent collection, and compliance tools built for recovery residences at behavehealth.com.